Welcome everyone to the session about the European Health Data Space Regulation. My name is Geoffrey Ceunen. I'm the managing partner and founder of Umaniq, and with Umaniq we are focusing on data and AI compliance. I also am a lecturer at the AI Compliance Officer graduate, and I'm focusing on, let's say, for more than 10 years right now, on everything related to data and digital laws. Voila. Today I will speak about the European Health Data Space Regulation, a legal perspective. I know that's not really the most interesting part always, but it is necessary, and it is one of the first regulations that's really focusing on innovation. So that's why European Health Data Space Regulation is a very interesting regulation. The European Health Data Space Regulation is actually coming from the EU data strategy, and with the EU data strategy, the EU really wants to create a single market for data and focusing on data-driven innovation. It also wants to protect their own EU values and EU rights. Keeping this in mind, and European Health Data Space is really the first data space in Europe right now. So there are other data spaces coming, but European Health Data Space is the first one. There's also a lot of interconnections, overlapping regulations right now. I can assume that you have seen already a lot of regulation like the AI Act, Cybersecurity Act, the New Product Liability Directive, and so on, which are the most important one to understand the European Health Data Space Regulation. It's really the Data Act, the Data Governance Act, and the GDPR. So the foundation of the European Health Data Space Regulation are these three regulations, and I also will guide you through these three regulations to really understand European Health Data Space Regulation actually. So it can be a recap for some people, but yeah, if you have questions about those regulations, it is still interesting to understand them correctly, because the European Health Data Space Regulation is completely based on those three regulations. So we start with the GDPR and health data. So what is the territorial scope of GDPR? So the territorial scope of GDPR is about companies who are located in the EU, so in Europe, who are providing services and goods to European citizens, or doing monitoring of behavior of EU citizens. The measured scope, personal data, processing activities, and automated and non-automated processing activities. And yeah, like everyone already knows, in the meantime, I guess that personal data is data that can be related to a person. Processing activities can be almost everything from collection to capturing to store personal data. Voila. You have different actors also in the GDPR. So you have the controller, you have the processor, you have joint controllers. It's quite important to understand these correctly, because you will see in the European Health Data Space Regulation that there will be a lot of other actors there, and if you don't understand the controller and the processor, then it's very difficult to understand the European Health Data Space Regulation and all the obligations that's coming with them. The controller really determines the purposes and the means of the personal data, and is instructing the processor, and the processor is really processing data on behalf of the controller. You have also the different concepts, so joint controller to joint controller, where both companies are determining, let's say, the purposes and the means of how they are processing and who is processing the personal data. This is something that you will see more and more also with European Health Data Space, that you have two joint controllers which are sharing, let's say, both responsibilities. These are the GDPR principles. Why I'm showing this again, all these principles are also coming back in the European Health Data Space Regulation. Lawfulness, of course, there need to be a legal ground, but the purpose limitation is also a very important one. Data minimization, accuracy, storage limitation, integrity, and accountability. What you will see with purpose limitation in the European Health Data Space Regulation later on, you can only share the data for the same purpose that the data is collected. That's a principle that's also coming back in the GDPR and in the European Health Data Space Regulation. If we look at the rights of the data subject, that's really the basis of the European Health Data Space Regulation. So data subjects right now, they have the right to access, right to information, the right to data portability, right to erasure. These are all rights that are coming back in the European Health Data Space and the European Health Data Space Regulation. And these are the different rights for a data subject that you really need to take to into account. So processing data under the GDPR, Article 9 is saying that processing health data is quite prohibited unless there are some exceptions, and these you can find in Article 9 where explicit content, vital interest, public interest, and scientific research is an exception. What's interesting here, explicit consent will be used for primary use of health data in the European Health Data Space Regulation. Scientific research is a legal basis out Article 9 that you can use for secondary use, and something that will be clear more later on in the next slides, but please keep these two definitely in mind. Then we have the Data Act. I'm not sure if you ever heard of the Data Act, or if you're aware of Data Act here in this room, not yet. So the Data Act is the next step towards the European Health Data Space Regulation. And what is the Data Act doing? So they want to, let's say, enhance innovation with making data more accessible within connected devices. So if you're talking about medical equipment, medical devices, that's the goal of the Data Act, to make this more accessible. Now within the Data Act, we're not only focusing on the personal data, but we're also focusing on non-personal data here. So the Data Act is really the next step towards the European Health Data Space Regulation. And again, in the Data Act, you have different actors, not the same actors as in GDPR, but you have different actors. You have a user, you have a data holder, and you have a data recipient. A user is not always a data subject, it's not always a patient. Who is the user of the data? It can also be a healthcare provider. So a doctor, for example, can be a user of a medical device, let's say, in the Data Act. That's important because it can be a patient who is wearing a pacemaker, but it can also be a healthcare provider who is using an ECG monitor, for example. Then we have the data holder, and the main goal of the data holder, they need to make sure that they make the data accessible to the data recipients, and it can be a manufacturer, a platform provider, who are making use of health data within your organization. We have the data recipient, and that's also something interesting for research later on in the European Health Data Space Regulation. The recipient is, of course, receiving the health data from the data holder. And this can be, for example, a hospital or a research institution. The main goal of the Data Act, like I told you, making data more accessible, but the main goal is also to stimulate innovation. And with the Data Act, they are, let's say, make it mandatory for the data holders to share data with recipients to improve, let's say, innovation, research, policy making, and so on. What are the key provisions in the Data Act? I want to go through them quite fast, but on a high level, let's say. So access to data for user, that's something we already told. You have more access as a patient. The healthcare providers have more access and easily accessible data. Data sharing between businesses here, it should be fair and transparent, but also what's interesting here, the data holder can ask for a reasonable compensation here. Upon request, of course. So if you're sharing data as a data holder, a manufacturer of a medical device can ask money to share the data with the data recipient, which is quite interesting. Access by public sector in emergencies. Think about the COVID-19 situation we had in Europe, for example. The public sector, medical devices manufacturers need to share their data directly with with the government bodies. Then this one was also a good one. So protection against unfair contract terms. What we're seeing more and more is that the big parties, the big companies, are, let's say, imposing unfair terms in data sharing agreements. So with the Data Act, they want to stimulate SMEs to negotiate with larger companies within data sharing agreements without imposing, let's say, unfair terms. Interoperability standards and protection against international access, which is quite interesting in the geopolitical situation that we are right now. And the Data Act is improving the single market of Europe within about the data, and not sharing it with other countries outside, let's say, the EU, without any requirements. Last but not least, before we go to the European Health Data Space Regulation, we have the Data Governance Act. The Data Governance Act is really, let's say, enhancing data availability, stimulating data altruism, which is very interesting for secondary use of health data. And they want to, let's say, establish a secure framework for sharing data between public and private organizations. So they're also covering intermediation entities. These are really independent entities who are taking care of facilitating the data between, let's say, public and private entities. But it's not the same, as we will see later on, as the health data access bodies in the European Health Data Space Regulations. It's not a mandatory body, but the Data Governance Act is governing this part. Data altruism, so people are going to share, or it's the Data Governance Act wants to stimulate that people are going to share their data. For example, for research, for policy making, for innovation. That's what the Data Governance Act tries to facilitate at this moment. And it also tries to stimulate the European Health Data Space objectives to increase, let's say, public participation and secondary use of data for, again, research, policy making, or innovation. It also makes sure that the sharing of the data is compliant with privacy law, GDPR, and with other European laws, like we saw a couple of slides ago. And then we have the European Health Data Space, finally. So the European Health Data Space, who is really benefiting from the European Health Data Space Regulations? Citizens who can have more and more access to their own data and really determine what's going to happen with their own data and who's going to see the data. And the healthcare providers, of course. If I'm going on a ski trip to France, I have an accident there, the doctor there can go into my data and directly see what type of blood group I'm having or something like this. We can reduce costs. We don't need to test everything again when I'm going to a doctor or a healthcare professional over there. So that's what European Health Data Space really aims if you're talking about primary use. Researchers also, there's a lack of quality and quantity of data right now in research in Europe apparently, so it makes it more accessible and more easy to share data within Europe, of course, for policymakers and also for the industry, for example, AI industry, that we can have more AI-driven and personalized solutions there. So that's really the goal of the European Health Data Space. The objectives, again, we have two main objectives here, like the primary use, the secondary use, and one main goal. Of course, the main goal, like you will probably already know, like the Data Act, Data Governance Act, is really to improve exchange of data within Europe. Primary use is really empowering citizens to have access to their data and know who is going to see your data. And then the secondary use is like enhancing the use of health data for research, innovation, and policy making. So primary use really, like I told you, empowers the citizens here, doctors and hospitals. And this also applies to both personal and non-personal data. And you can think about lab results, medical imaging, electronic prescriptions, and patient records that I can easily share with other doctors, for example, in Europe. Then we have secondary use. Secondary use is also a very critical part of innovation in Europe at the moment. The obligations for data holders are also coming from the Data Act and the Data Governance Act, like we mentioned before. What's interesting, and also in alignment with the GDPR here, is that the data should be anonymized or pseudonymized before we are sharing this, because we are talking about health data and sensitive personal data. And the use is also limited to specific purposes, also coming from the GDPR. If you're thinking about secondary use, think about scientific research, education, healthcare sector, public interest in relations to public health, and training and testing AI for public health. So we are seeing more and more AI solutions coming our way. So that's also an interesting part for secondary use. What's interesting here for secondary use, this is guided by the Belgium Health Data Access Body. We have an agency already in Belgium. There will also be a data body who is facilitating the data sharing of health data in Belgium. In the next slides, we'll see a little bit more about this. And yeah, they're taking care of these processes of approval. What's prohibited within the European health data space for secondary use? So decisions that negatively impact a patient, for example. You can't use secondary use data for decisions related to insurance, and also not for marketing activities or advertising. We already have a Belgian health data agency right now in Belgium. Since last year it's officially launched. It's an autonomous agency within the Volksvolk Gezondheid. I think it's FPS, Health, Food Chain, Safety and Environment or something like this in English, not sure. And the purpose is facilitating the secondary use of health data, innovation and policy making. So this is the agency. There will also be another body who's really facilitating this. If you go to their website, you can also follow a lot of courses about European health data space. So could also be very interesting there to follow. Responsibilities to coordinate, to facilitate really the data sharing, and also make sure again that this is really compliant with privacy laws, data laws within Europe. So that's the main goal of the Belgian Health Data Agency. And then last but not least, the most, let's say, positive probably slide of the complete presentation. We still have a lot of time to implement everything here. So what you will see is the European Health Data Space Regulation is published last week, the 5th of March. The 26th of March it enters into force. I think it's in 2 weeks right now. And then the Belgian body, the Health Data Access Body, has still 2 years to do their own implementation of the authority and the bodies here. And then in March 2029, so it's in 4 years, the primary use and secondary use health data needs to be compliant. And then we have till March 2031 to other health data categories to be compliant with that. So we still have a lot of time, but of course, like all compliancy and all laws, it's quite interesting to start really upfront on time.
I have a question about the we. You said we have a lot of time. I saw people tell me, saying this is a problem of only the Nexus Health and the EPD providers of this world, and the hospital doesn't need to care about it that much. Is that true?
Yeah, definitely not. Of course, hospitals also need to take care of this, and there's a difference between the primary use data and the secondary use. And you need really to facilitate this part. In secondary use, I can imagine that for example, in Nexus Health, but there is a collaboration with Europe, and also you need to make sure that your own policies, your own way of working, and that you need to capture everything related to data and patient data within your organization before you can share the data. If you don't know where the data is, you can share data. So your hospital or your company needs to be ready to move forward to the European Health Data Space Regulation. So I wouldn't say that, because also it's based on the data, the GDPR, Data Act, Data Governance Act. So you need to be, let's say, compliant with all these regulations before you go to the European Health Data Space Regulation instead, if that makes sense. So that was my presentation. Thank you.